Helen, thank you very much, and welcome to this session, which is this panel, which is the last of the morning session, where we're going to be talking about using accountability to advocate for adolescent health. So this is a session which is about data, what data we should be collecting, how we should collect it, how we should analyze it, how we should communicate it to civil society, young people, and the constituents for adolescent health. And let me say at the outset, I want to congratulate CanWatch and the committee here for putting data on a panel in the first session of the conference. Those of us who deal with data are usually consigned to the conference witching hour with half a dozen people left, the diehards who are really interested in this area. But data is going to be central to any agenda in adolescent health moving forward, whether nationally or globally. Without data on adolescent health, the health problems of young people are invisible. Without data, one's not able to set priorities. One's not able to communicate need to civil society. Without data, one's not able to monitor change and the effectiveness of the actions that we're taking. So without data, we don't have any accountability. But the challenge is that our global data systems were not set up with adolescents and young people in mind. In fact, they're uniquely ill-suited to provide us with the data they need. So that is the challenge ahead, and that's the challenge for our speakers today. Our first speaker, Zulfi Bhutta, is going to be talking about some of those challenges in the context of the Countdown program. Our second speaker, Caroline, is going to be talking about how we need to consider gender in our data collection systems. Not just gender in terms of disaggregation by sex, but truly gender-sensitive data collections. And our last speaker, Marion, is going to be telling us about the power of young people in data collection. So we're going to kick off with Zulfi first. Over to you, Zulfi.
So good morning, and it's wonderful to be here amongst friends, and particularly with so many young people in the audience. So this has been a morning of anecdotes and personal stories. So I'd like to start with my own. So I'm a neonatologist, and I work in global child health. Neonatologist, for my young friends in the audience, is a study of small babies. You start with newborns. The more premature they are, the greater the challenge. And that's what I spent a lot of my career on. And as my own children grew older, I recognized that as a pediatrician, the biggest gap that we had was in information that went beyond school age. The first 5 years of age in particular, that's been on our focus. And the person who taught me most about adolescent health is actually my youngest daughter, who's now 24. So thank you very much, young people in the audience, for showing us the light in terms of how we need to look at the spectrum of the continuum of maternal, newborn, child, and adolescent health. So I want to start with the numbers and just to recognize that if you take strict 10 to 19 years of age, adolescents account for 16% of the total global population. And if you take the 0 to 18 years of age, then in many countries, that age group accounts for about half the population. So this is an enormously important constituency, both in terms of issues, challenges, and the importance of their linkage to the Every Woman, Every Child strategy. Now, we had, as the independent expert review group, which is the precedent of the independent advisory panel now, set up by the UN Secretary General to look at the Millennium Development Goals, we had identified that this was a huge global gap in terms of visibility. And this statement made in our 2013 report stands true even today, that there are very few specific outcomes that have been changed in the context of the new Every Woman, Every Child strategy, but at that time, it was quite apparent that these were invisible in the MDGs. We also pointed out that we did not know how to monitor adolescent health because we weren't very clear in terms of the various indicators that were potentially available to look at the entire spectrum of adolescent health, nutrition, including many of the things that you've spoken about in this morning's session around sexual and reproductive health. And then came George, a year or so later, with his Adolescent Commission that I was very honored to be part of, and they expanded that list of things that we needed to measure in terms of adolescent indicators to what you see on this panel here. And as you can quickly calculate, that these 28 indicators are quite comprehensive, that go across the entire range of health, nutrition, mental health, sexual reproductive health, and also indicators that measure access. So how are we approaching this? So I want to speak to you in my capacity as one of the co-chairs of the Countdown Now, the Countdown to 2030 process, in terms of working diligently towards the inclusion of adolescent indicators within the Countdown report. So the Countdown currently looks at 81 countries of the world, which have between them close to around 98% of the total burden, as we understand, of maternal newborn child and adolescent mortality. So our focus is to start with the areas where we believe there needs to be focus with some degree of immediacy, reproductive health and nutrition, and not to exclude other things that would come in over time. And we do want to have these measurements available at both global as well as regional levels. Now, this is a complex slide. We're not going to read this, but I just want to point out to you that we have divided things into 3 tiers as Countdown. Tier 1 are the indicators. If I can go back. Tier 1 are the indicators that will be included in our Countdown country profiles, the 2-page country profiles that many of you are aware of, and they will be included as of this year. Tier 2 are indicators that we believe we might be able to produce as part of our country-level profiles, but will only be available on the web. So those who want to take a deeper dive will have to go to the web to see some of these where they exist. And the last tier are things that we want to measure but are somewhat aspirational, because we do not, at this point in time, have a clear handle outside of modeling to get to some of the things like, for example, the proportion of maternal deaths amongst adolescent girls or cause-specific mortality in adolescents. And we really would like to do a better job on that over time. So to summarize, the global measurement activities in the Countdown to 2030 process starting now will be indicators that we will try and harmonize as best to the Sustainable Development Goals, to the global strategy, and to the recommendations of the Lancet Adolescent Commission. These will be part of the country profiles. They're summarized in the box that you see in front of you, and additional work will be commissioned in terms of filling the gaps, particularly around areas of immunization coverage. We would like to get a better handle on how we are doing for things for which there is evidence enough for inclusion in programs like HPV vaccine coverage. There will be additional activities as part of regional capacity development exercises. Countdown 2030 is going to have a specific focus on regions and geographies with a lot of capacity enhancement. And we believe that these multi-country case studies that will include regions like West Africa, East Africa, Central Asia, Southeast Asia, will have the ability to do a lot more in terms of a deeper dive on adolescent health, and will identify also priority issues that have been recognized in certain geographies. I'm very pleased to see Princess Sarah Zaid in the audience, because we definitely want to look at adolescent health in the context of humanitarian settings and complex emergencies. And I want to finish by what we would ideally like to see in the context of adolescent measurements globally. Not just numbers, not just uniform country-level estimates, but also disaggregated data by equity indicators, so we are able to look at what we have in the context of not only distribution by asset quintiles, but hopefully by geospatial measurement and monitoring of adolescent health. And my own particular dream is to one day be able to see the differences that we might have in many geographies between the urban and rural populations, and particularly the adolescent girls and boys living in urban slums. So thank you very much for your attention. We'll be happy to take questions in the panel.
Okay, I have to use the clicker. This is the toughest part of all of this. Okay, good. I'm Caroline Riseborough, President and CEO of Plan International Canada. And for those of you who may not know, Plan recently refocused its mission and vision to put girls at the center of our work, making us the largest INGO in the world, specifically focused on girls. I'm really proud to be able to share what Plan is doing in terms of its data work, and also really how we're marrying data and accountability mechanisms to render girls at the center and overcome really the invisibility that has happened over many years. So to start here, what I've put up is really Plan's accountability framework for all of our programming. And in a lot of our MNCH work and our SRHR work, we are collecting facility and community-based data to measure change in outcomes both by age and by sex. And we've married that with a very robust measurement and evaluation methodology that specifically looks at vulnerability. And I think someone mentioned it here, adolescent girls are double cursed, or I'd like to say double discriminated against because of both their age and sex, which rendering them one of the most vulnerable groups on the face of the earth. But specifically, when we look at vulnerabilities, we are able to then use that data to inform and engage in discussion with health departments, community members, specifically around the issues and the barriers being faced by women and girls to close the gaps of service there. And we've been doing that in Bangladesh, Ethiopia, Ghana. And this is really about demonstrating how data can help bring about change, because it allows us to underscore who is the most vulnerable and why are they the most vulnerable, and talk about solutions to be able to reach the most vulnerable, particularly important as we begin to address the SDGs. So, talking about the SDGs, one thing that Plan has been doing over the last almost 10 years is we have released our State of the World's Girl Report, where we've been using data, taking a look at the impact and the issues affecting girls, and really building evidence and putting in the voices of girls within this report. One of the things that this report has revealed is that the data about girls is either incomplete or completely missing at all. And part of that is simply because what has been mentioned here is the lack of disaggregated and detailed collection of data looking at things by age and by sex. So for example, we have no idea how many girls leave school because of early and forced marriage, because of violence, because of early pregnancy. We have no idea how many births are happening before girls turn 15, or how many girls spend working both in unpaid manners and paid. And what was interesting, I was in El Salvador a couple of weeks ago. We learned in El Salvador that 30% of births are from girls 18 or under. But when I spoke to the Plan staff who are working in the field, they're saying some of those births are happening at 10 years of age, 12 years of age, but we simply don't have the data to be able to understand what's really happening. Interestingly, in areas where Plan was working, we had been able to reduce that number to 0. But what's interesting is we have the Sustainable Development Goals, which are ambitious in nature and have really committed to leaving no one behind. And yet, we have to confront a stark reality that most of the goals cannot yet fully be measured. We are not collecting data for more than half of the SDG indicators. And so, what happens in all of this is girls continue to remain invisible because they are not in the data, and particularly because oftentimes girls get lost within the data that we're collecting for children or the data that we're collecting for women. Adolescent girls who remain the most vulnerable are not showing up in the data at all, and it just continues to exacerbate their invisibility. And so it's impossible for these girls, for youth to be able to engage with government stakeholders, with duty bearers in discussions around their rights if they don't have access to the data. So what is Plan doing about it? Well, we've launched an initiative called Equal Measures 2030 with a number of different partners. You can see them there. And what we are going to do is we are going to start to collect data over the course of the SDGs, specifically around girls, adolescent girls, looking at much more detailed data disaggregated by age and sex. And what we are going to do with this data is not just collect it, but put it in the hands of the girls and women's movement to be able to give them the power to create stronger accountability between themselves and their duty bearers, the decision makers, their government. So in terms of a bit of details around Equal Measures 2030, we are going to create a data tracking tool. It will monitor a priority set of targets and indicators, specifically around making progress towards the gender equality targets and measures of the SDGs. It's going to be collected from all countries using existing data sources. We are going to compile it in a global database. But one of the issues that we believe this will help address is really highlighting the gaps within data so that women and girls are able to put pressure on their governments to increase and expand upon the data collection. And for areas where there is not that data, we will collect further data from citizen-generated data, from other NGOs, from the private sector, and really include the voice of adolescent girls within that. So why am I telling you this? Why is this important? Well, at the end of the day, movements do not have power if they do not have access to the very data and information that affects their lives. And so part of what Equal Measures will do is put this power into the hands of adolescent girls, women, and the decision makers to be able to empower girl-led and women-led advocacy. We are going to focus on 6 countries as well and work closely with the local women's rights organizations and girls-led organizations to increase the capacity both at the local community and national level to build advocacy and accountability. And really, again, we can't continue to say that we are going to empower youth, which we have said within this sector for many, many years, if we exclude that very youth from the data that affects their lives. So as President and CEO of Plan International Canada, I want to make it one of my goals to be able to put data into the hands of the very girls and women that we are looking to help and empower. Thank you.
Hi everyone. So my name is Marion Cosquer. I'm 24 and I work at UNICEF France, where I am an advocacy assistant, but I'm also a EU reporter. So today I will tell you what that means and what is your report. So your report is a global tool developed by UNICEF. It allows young people to take part in polls, access information, and send questions on issues that matter to them. It is famous for SMS, but it's increasingly available on social media. It is currently live in 35 countries, with 10 more countries in the pipeline, and UNICEF Canada is actually looking into implementing it. There are currently over 3 million new reporters worldwide, and UNICEF's goal through a EU report are to scale, to engage the youth, and to achieve positive change. For young people for which EU report is not available in their country, they can become EU reporter through EU Report Global. So I will now show you a short video from EU Report Nigeria, which gives you an overview of how EU Report works. Because EU Report is a global tool, but each country decides on the issues they would like to address and why. Results are then published in real time and aggregated by gender, age, and location.
Are you a Nigerian? Do you live in Nigeria? Do you face the issues that affect Nigerians? Do you have specific issues in your community that require urgent attention? Do you know that now you can speak up about what's happening in your community and someone will listen? That through your voice, you can join thousands of others to make the leaders of your community change things for the better. You can do all this with UReport. UReport is a free SMS platform powered by UNICEF to identify and address issues that affect your community. With any kind of GSM phone, you can bring issues within your community to the knowledge of those who should be held accountable in order to demand better service. Weekly polls are sent to several thousands of UReport subscribers across all local governments in Nigeria on issues that affect community development. Once everyone replies, the answers are received and analyzed in real time. This feedback is then made available through SMS feedback, the UReport website, on TV, radio, and in the newspapers. Through UReport, political leaders at all levels of government can understand the issues real Nigerians face. And with your feedback, they can advocate for the right resources that will bring real development to your communities. You can join UReport for free by texting JOIN to 24453. Once you join, you too can become a UReporter and will be able to speak out about issues in your community, improve your knowledge with facts, participate in nationwide campaigns to improve Nigeria. You too can make a real difference by joining UReport. Be part of the change you desire. Join UReport today.
So that was a short video to save me some time because we're running a bit late. So now I will talk about, one of UReport's biggest success stories, which took place in Liberia and Sierra Leone during the Ebola crisis. So back in 2014, UNICEF identified the need to improve information and communication flows between relevant government ministries and affected communities. And this is why UReport was deployed in those countries during the outbreaks. The deployment of UReport was actually a great success and enabled governments and NGOs to monitor the evolution of the outbreak, to identify affected communities, to measure the effectiveness of radio campaigns, and to educate and inform young people about the evolution of the disease. As a result, UNICEF used UReport data to redirect resources to increase the visibility of the campaigns in areas reporting the highest rates of absence. And actually many reporters have said that the poll results helped them realize that Ebola was a real threat and it was not fake, because some people actually thought that it was fake or that it was not in where they lived. With UReport, as I mentioned earlier, UReport Global, we're also able to send out surveys to our 3 million UReporters worldwide. For example, UReport enabled us to collect more information and to engage girls in conversation about menstrual hygiene management, which is a neglected area without global data. The global poll allowed us to survey 1.8 million girls for MH Day, with a focus on school attendance during menstruation. The results will be shared nationally and globally on Menstrual Hygiene Day, which is May 28th, and will be made available to actors in the field. Many countries will be conducting live chats that day to answer UReporters' questions. Last March, actually, UReport Pakistan had already sent out such a survey, revealing that social norms prevail surrounding menstruation, that girls lack knowledge on menstrual hygiene, and that breaking the silence around period matters to them. They also organized live chats, and UReporters were able to send questions to WASH officers, with more than 5,000 messages received. So, yep, that was my presentation.
Thank you to all our speakers. We're going to be opening up for comments, questions from the floor in a tick. I think the message here is that there's a big job ahead of us around data systems. I'd like to sort of ask the panel a couple of questions first off to get them going, and then I'll open the floor. There are a couple of microphones here that I'll ask you to come to. But by way of questions, and perhaps this one is more for Marion, we're going to need a lot of advocacy to get better data systems for adolescent health. So to have some powerful examples here of examples where we've used data, perhaps where young people, young leaders have used data to bring about change, to bring about policy change or action. I'd be really interested to hear your thoughts on that question first off. And a second question, which is more for Zulfi and Caroline, which is around the architecture of data collection globally. We don't have good primary data, for example, on all-cause mortality, one of the key indicators. We don't collect these data well, and we're a little bit dependent on vital registration systems that don't exist in many countries. So, Zulfi and Caroline, what are the steps that we can be taking from an adolescent health perspective to reorientate our data collection systems? What is the power of information technology to bring about change and better data? Marion, would you like to kick off?
Yeah, sure. So there are a couple of examples of Eureport data being picked up to influence policies and programs and to engage youth mobilization, but we'll briefly talk about one example. So in Liberia in 2015, there was a poll entitled Sex for Grades that was sent out to Liberian e-reporters. And to highlight the issue in Liberia of teachers exploiting children by awarding grades or pass marks in return for sex. Reporters were asked if they believed this was an issue in schools in their community, and were given information on how to report such acts, and were also provided with a helpline for counseling and support. 13,000 responses were received, and the results showed that 86% of reporters believed this was an issue in their schools. As a result, reporters were given, sorry, it was a bit weird, were given the Ministry of Education information to report the act, and they were also provided, and the helpline that was available to them was also inundated with answers, which showed that it was actually a very important issue to address. And UNICEF and the Ministry of Education actually released a joint statement in order to act on this issue.
Brilliant. Thank you. Caroline?
You know what, let me try and answer the first part of your question around sort of empowering youth with data for advocacy. Part of Equal Measures 2030 is trying to bring the data to life. So let me try and bring this issue to life with an illustration. Again, I just returned from El Salvador. We were meeting with a group of probably about 20 or so young girls, adolescent girls. And what's interesting, we were specifically talking about issues around sexual health and reproductive rights. And in El Salvador, contraception is available free to most adolescent girls and boys, and yet we see really high numbers of girls dropping out of school, low levels of completion of secondary school from girls, and a high number of pregnancies at adolescents. But we didn't have the data to be able to engage in the discussion as to why that is. And oftentimes the assumption is they don't have access. That wasn't the case. So where is the more detailed data allowing us to engage in the discussion as to why? Because we didn't have it, it was very difficult to engage in the discussion. And then how from there can we expect youth to engage in the discussion with their community leaders, with their governments, when they don't have the data to be able to build solid policy recommendations, whether that's with religious leaders, whether that's with government leaders. years. So again, this is where we need better data, not just disaggregated data, but data that goes into more detail and data that engages at the community and local level to be able to bring it to life and understand both the implications of this data.
Thank you. Sophie.
So I'd like to add on to that to say that while I completely support the notion of engaging youth and adolescents in data collection empowerment, and principally giving that constituency the voice and political support to influence health systems and interventions, I'm also cognizant of the fact that a large proportion of the issues and challenges, particularly in the younger adolescents, are also in circumstances that we need to be innovative in terms of how we get those information systems linked to school systems, also to community empowerment in terms of collecting information from those who are out of school, and also empowering some of that data collection around activities that relate to women's groups and community support groups. That's where the real challenge lies. Now, one of the mistakes that was made, I believe personally, as part of the Millennium Development Goal process, that we left the whole issue of linking surveys and particularly reports based on some of those cross-sectional assessments. We did not spend enough time on linking those to vital registration systems or to administrative reporting system, the DHIS, the systems that we have invested so much on to provide dashboards and real-time data collection. I don't think we should make the same error moving forward in the Sustainable Development Goals era. So I'd like to personally see a lot more effort being placed within the district health information systems on collecting information across a range of platforms, be those health or non-health, safety nets, labor. A lot of the youth, young people are in the labor force. When we were not going to get information from them outside of, platforms where they work. I've already mentioned education system. I've talked about community empowerment through activities that are already in place in community settings. To link those somehow to information systems that we have at district level will allow us in a few years, 5 years, 10 years from now, to be talking about not only real-time data, but data that empowers communities way beyond what information systems we currently have in place.
Thank you very much, Sophie. Look, those are really important messages. The need to look beyond where we traditionally focus in health, which is health service systems, to other sectors. I think the power of local data in local hands and the power of data in the hands of young people. So those are really important themes we need to take forward. Now, it's over to you. We have 10 minutes, almost, maybe 9 minutes now, I think, for questions, comments. Please introduce yourself with your name and where you're from.
Shekhar Saxena, work for WHO. Although mental health and self-harm have been emphasized by almost all speakers since the morning, I did not find that on the slide of Zulfi. Neither has anybody else talked about it. Do we still continue to believe that either there is no data or it's not important? If we don't measure it, we'll not do anything about it.
Right. Thank you very much for that comment. Let's take another couple of questions and then turn it over to the panel.
Thank you very much. My name is Patrick Mwesije. I'm from Uganda, and I work with the Uganda Youth and Adolescent Health Forum. And I'm also a member of the Adolescent and Youth Constituency of PMNCH. I just wanted to throw this to Professor Zulfi. Yes. There is, I know we still have data gaps, especially in line with a couple of adolescent health-related issues. But there is some existing level of evidence at country level, even globally, and which really makes a lot of sense, and which, if young people really understand and can interpret this evidence, can make a lot of advances in terms of policy change. But you see, one problem we're facing is that even the existing evidence is not interpretable by young people, because it comes in very complicated language that is interpreted by professors like you guys, But for an adolescent of 15 years, a young person of 20, 22 years, will not interpret those scientific, So and also the dissemination. You see, some of the research that is done does not even have a dissemination kind of framework, you know, so it's just up there. The demographic health surveys are up there, and, you know. So just to wind up, I want to give you a very simple example. In Uganda, there is one thing that we managed to push as young people. So when our maternal mortality rates since 2011 up to 2016 were about 438 per 100,000 live births, but that was, you know, interpreted into like about 16 women dying on a daily basis. So young people got to know about this. So they kept talking about it, tweeting about it, and every leader was really, really concerned. Today, recently we saw in the recent presidential elections, almost in every manifesto of every presidential candidate, there was an element of maternal and child health. You know, just because of simply interpreting the 16 women who die daily. So how do we disseminate evidence to young people, and how do we make it interpretable by young people?
Thank you very much. You've made that point very, very clearly. We'll take one more question, just briefly, if we can, and then we'll turn it over to the panel for comment.
Hello, my name is Isabel Kim. Thank you very much for an interesting panel. I work with Presbyterian World Service and Development, and we receive GAC funding for a PSMNCH project in Afghanistan and Malawi. I was fascinated by the U report video in your presentation. I'm wondering, in a country like Afghanistan, where we have a PSMNCH project, girls' education projects as well, what's the potential uptake for U report? And speaking of data, do we have data with regards to the potential uptake in different countries of such a cell phone-based system that requires young people, and especially in the case of vulnerable girls in Afghanistan and young women, for them to have a cell phone to be able to use the U report?
Right, okay, so a couple of questions here. One around mental health. There's no health in adolescent health without mental health, but we're not measuring it. And about putting power into the hands and data into the hands of young people. Who'd like to go?
Maybe I can take Shekhar's question and the question from the young advocate from Uganda. So Shekhar, there is mental health within the listing of indicators that we have. At this point in time, we also recognize that our current data sources are wholly inadequate in terms of doing a good job on this. So a lot of the stuff that is going to come into the adolescent mental health indicators, I think, are largely going to come from special surveys, just by the nature of those things. I mean, it's very difficult to incorporate reasonably valid indicators within the demographic and health surveys or the multiple indicator cluster surveys from which a lot of these are derived. And that's where you and I come in, is that what kind of representative special studies can we have in place for the right age groups in terms of getting that information into the mainstream of the prevalence as well as the interventions that we have for many of those indicators. That's one of the reasons why I would also like to expand this issue of what indicators are we capturing at what age group in relation to interventions to also the younger age within the adolescent framework. A lot of the evidence review in terms, and you know, my group has done much of the evidence review for adolescent health and nutrition in the last few years to recognize that many of the interventions that we actually talk about putting in place during that age group is ineffective because we haven't started early enough. And that's one of the challenges that we have in terms of linking this to the school platforms or the community platforms that we have for those who are out of school. So I do think that we have a huge responsibility and a challenge right now to getting the right indicators in. And coming back to the question very rightly stated from Uganda, there is an opportunity right now to use some of the information that we have from existing surveys, both representative and small-scale surveys, disaggregated by age group, to use those for advocacy. In the geography that I work in, largely in South Asia, in the Pakistan-Afghanistan area, we know already enough from many of those surveys to make the case for age at marriage, young girls who encounter morbidity and mortality within the reproductive framework. And also, we have enough information on youth, as I mentioned, in the labor force. Let's try and make use of some of that information to make the case for action now to policymakers but to also advocate for better systems of data collection.
Thank you very much. Now we have 1 minute, I think, left. It's great to see such passion for data. Caroline, Marianne, very quick comments.
Add to that quickly. I think we have two major issues that the people in this room need to help solve, which are the gaps within the data, but the gaps within disseminating the data. And it's not just good enough to disseminate the data within this crowd, but how are we actually disseminating the data down to the very people with whom we're collecting the data and for which the data brings visibility. And there is a lot of power in that. When I look at some of the work that Plan has done specifically around maternal and child health, we've been trying to take a gender transformative approach, which is not just changing the condition within which girls and women live, but their position within society. Part of the way that we have to do that is engaging men and boys to talk about power distribution within across genders within relationships. The way that we've been able to engage in those discussions is through talking and showing the data that we've collected. So the data is not just important to disseminate back, but it is a powerful tool for engaging in discussion, and it's not just with duty bearers and political duty bearers, but it's with duty bearers within the household as well.
So data is empowering. Marianne, you have the last word quickly.
Yes, so I didn't hear your question well, but because the mic was faint, but I know, so you've asked me about girls in Afghanistan that do not have cell phones and how can they become U-reporters and actually contribute to the U-report movement. So that's a great question, because obviously U-report works through SMS or social media, but you require a phone. But for example, your report is actually live in Syria, and it's very symbolic because there are few reporters, I think only a couple hundreds. And polls are not sent very often because the polls are actually designed by the youth and for the youth, and they have to have the resources to actually be able to, manage your report. So in Afghanistan, I don't know particularly how, if your UNICEF in Afghanistan is planning to implement it, but the goal is for the youth of every country to actually advocate for their rights to speak, to express their opinions and actually voice their willingness to talk about issues that matter to them. And so the struggle is indeed to how can you become your reporter when you don't have a phone? And this is also it's a remark that we get when people say, but in some countries, girls don't have access to phones and boys have larger access than girls. So those are remarks that we take into account to, make your report more precise and more accessible in every country. But I will be glad to answer your questions during the break and actually talk about your report success stories in every country and yep.
Thank you, Marianne. My apologies to those of you who didn't get to make your question. This is going to be a theme we're going to continue through the next 2 days, so please keep your questions. There will be opportunities. Please join me in thanking our speakers this session and enjoy morning tea.